A few years back, a woman with English name Sarah walked into my clinic. She was 42, a mum of 2, and she'd just gotten her pathology report 3 days earlier, invasive ductal carcinoma. I remember her hands were shaking as she put this huge stack of medical papers down on my desk. But honestly, what got me wasn't just the fear on her face, it was how confused she was. Her oncologist was telling her, surgery first, then chemo. Meanwhile, her friends were pulling her in every direction. Don't do chemo, it'll wreck your body. Just drink this miracle Chinese tea. And then someone else would say the opposite. Stay away from herbs, they'll mess with your Western medicine. Sarah just looked at me, tears in her eyes, and asked, "Doctor, who am I supposed to listen to? Is Chinese medicine actually an alternative to Western treatment, or is it just a dangerous distraction?" If you've just been diagnosed with breast cancer, or someone you know has, I think you understand exactly how Sarah felt. Overwhelmed, scared of the side effects, just trying to find the safest way forward. Hey everyone, welcome back. It's Dr. Yao. I've been doing this for over 40 years now. Clinical work, research, teaching, all focused on cancer treatment. Here's the deal with this channel. I want to show you why integrative medicine is honestly one of the most underrated tools out there, and how pairing cutting-edge oncology with the whole body wisdom of Eastern medicine can seriously change the game for you. Okay, let's get into it. Today kicks off our new breast cancer series, the Integrative Oncology Support Journey. And here's our whole goal with this series: cut through the noise, bust the myths, and show you how integrative therapy can protect both your life and your quality of life from the breast cancer. Quick disclaimer before we dive in, this video is for education only. It's not personal medical advice. Your cancer treatment should always be guided by your actual medical team. When people get diagnosed with breast cancer, they usually fall into one of 2 traps when it comes to TCM. And I want to tackle both today because either one can really hurt you. Trap number 1, thinking TCM is some kind of miracle cure that can replace Western medicine. Let me be super clear. There is no herb, no formula, nothing that can replace surgery, chemo, targeted therapy, or radiation for treating breast cancer. None. If someone tells you, skip the surgery, just drink my tea and the tumor will disappear, run. Delaying real treatment for unproven cures is one of the biggest reasons early stage cancers turn into advanced ones. Western medicine is still your best tool for actually removing and killing cancer cells. Trap number 2, rejecting TCM completely out of fear. On the flip side, some patients, and even some doctors who aren't familiar with the research, think TCM should never be part of cancer care. They're worried it'll interfere with chemo, hurt your liver, maybe even feed the tumor. And look, it's true. Herbs used carelessly can cause harm. But if you reject properly managed TCM altogether, you're missing out on one of the best tools we have for easing chemo nausea, protecting your bone marrow, reducing swelling, and calming the joint pain that comes with long-term hormone therapy. So if TCM isn't a magic cure, but it's not something to throw away either. What does it actually do? Here's how I like to explain it. Think of your body fighting cancer like defending a castle. Your body is the fortress. The tumor is an army that's broken through the outer walls. Western oncology, that's your heavy artillery and special forces. Surgery is the strike team that takes out the main enemy camp. Chemo and radiation are like carpet bombing the battlefield to wipe out whatever's left. Targeted therapy and immunotherapy are your snipers. Without this stuff, you're not winning a fight against something this aggressive. But here's the catch. Heavy weapons cause collateral damage. They blow holes in your walls, wreck your food supply, exhaust your soldiers. Clinically, that looks like low white blood cell counts, brutal nausea, exhaustion, organ stress. That's where TCM comes in. Think of it as your supply line and reconstruction crew. Western medicine is all about killing the invader, what TCM calls clearing pathogens. TCM's job is keeping the fortress standing, strengthening your body's core energy. It keeps the farms running so your soldiers don't starve. That's your digestive system and bone marrow. It patches the walls, that's your immune system. It keeps the water flowing so smoke doesn't choke the city. That's managing lymphedema and toxic side effects. If you've only got artillery and no supply line, your fortress collapses from exhaustion before the war's even over. If you've only got supplies and no artillery, the invaders just walk right in. Real victory happens when both sides work together. Okay, so now that you get the philosophy, let's get practical. When exactly should TCM come into the picture? There are 4 key windows. Window 1, around surgery. Before surgery, it's about calming your nerves, helping you sleep, and getting your body in the best shape possible for anesthesia. After surgery, it's about healing faster, reducing fluid buildup, and recovering from the fatigue that comes with anesthesia, using gentle formulas that build energy and blood. Window 2, during chemo and radiation. This is honestly where people suffer the most. During chemo, certain herbal combos, like ones built around astragalus or atractylodes, can help protect your bone marrow so your body keeps making white blood cells and platelets, which means fewer chemo delays. For nausea and appetite loss, there are herbs that protect your stomach lining. And for radiation, there are cooling, moisturizing herbs that help prevent skin burns and lung inflammation. Window 3, hormone therapy, the long haul. After active treatment, up to 80% of breast cancer patients go on estrogen blockers like tamoxifen for 5 to 10 years. These drugs save lives, but they basically trigger medical menopause, hot flashes, insomnia, joint stiffness, mood swings. A lot of women actually want to quit because of this. TCM uses gentle formulas that nourish and balance your body without adding synthetic hormones, so you can actually stay on the medication that's keeping you safe. Window 4, long-term recovery. Once active treatment is done and you're no evidence of disease, this is where TCM really shines. It's about improving your metabolism, clearing chronic inflammation, and strengthening your immune system, so your body becomes a bad environment for any leftover cancer cells to grow in. If you're going to bring TCM into your care, there's one golden rule: be completely transparent. Always tell your oncologist about any herbs or supplements you're taking, and work with a licensed TCM practitioner who actually specializes in integrative oncology, someone who can read your blood work, understands how herbs interact with drugs, and knows when to pull back during chemo cycles. This isn't about doing things behind your doctor's back. It's about your whole team being on the same page. And I want you to walk away from this knowing it's not guesswork. Every single herb we talk about in this channel has modern pharmacology research behind it. We're not just going off tradition alone. And the classic formulas we reference, some of them have been used for literally hundreds of years or over 1,000 years, which gives us a pretty solid track record on both safety and effectiveness. We'll drop the actual references and studies at the end of the video. So if you want to dig into the science yourself, you'll have everything you need. So remember Sarah? Once she understood the castle defense idea, that fear just lifted. She had her surgery, did her chemo on schedule, and had TCM support the whole way through. Today, she's 5 years cancer-free, full of energy, living her life. You don't have to pick a side here, Western science or ancient wisdom. You deserve both. And if you're wondering why top cancer centers around the world are actually adopting integrative therapy into their programs, check out the video on screen right now. I break it all down there. I'd love to hear from you. Where are you at in your treatment right now? What's scaring you? Or what questions do you have about combining the two approaches? Drop a comment. I'll try to answer as many as I can in future episodes. Next time, we're tackling a question that haunts almost every patient. Why did I get breast cancer? We'll dig into the root causes, emotional stress, liver Qi stagnation, metabolic imbalances, and translate all of that into modern biology. Hit subscribe, ring the bell, and I'll see you in the next one.